When someone is ill or injured, disturbances to their brain function can cause an acute confusional state that we call delirium.
I was out with my son playing golf and did my kneeing. When I woke up after the surgery, I didn't know where I was. I felt so confused and frightened. I was seeing spiders crawling on the bedsheet and strange figures and shadows in the corners of the room. Whenever the nurses tried to give me food or drink, I thought they were trying to poison me. I didn't know what was going on. It was a nightmare.
Each person's delirium is different. Symptoms can fluctuate and often come on suddenly. People can change mood or alertness very quickly. They can become agitated or aggressive, or at the other extreme, withdrawn or sleepy. They may have hallucinations or abnormal beliefs and have difficulty following conversations.
He changed completely in the hospital. Some days he would be so aggressive to the nurses they had to call security. Other days he would be so drowsy he barely spoke. Not the man I'd been married to for 40 years. We saw a doctor and one of the nurses from the liaison psychiatry team. They explained that Bill was experiencing something called a delirium, which I'd not actually heard of before. I was very happy to hear that this could be treated, because I thought I was losing him for good.
Anyone can get delirium if their illness is sufficiently severe, often those with dementia, older and frail people, as well as patients with hearing or visual impairment are more vulnerable.
The most important thing was to find and treat anything that was causing the delirium. Blood results were normal, but that didn't rule out infection or other causes of delirium. Bill had been started on strong painkillers after the operation, which were a common cause. Due to a delusion that his food and drink were poisoned, he hadn't been eating or drinking and had become dehydrated and constipated. I arranged for one of our nurses to visit the ward to support him at mealtimes and offer advice on some of the strategies that can help.
There are often multiple causes for delirium. Anything from an infection to a change in medication or environment, even dehydration can be a cause.
Just talking to the family was very effective. We spoke to them and the ward staff about how they could comfort and manage Bill when he got agitated. We worked together to create a calm, well-lit environment with no loud noises that could startle Bill. We also arranged for his glasses and hearing aids to be brought in, and this made it easier for us to talk to Bill and explain what was going on.
Delirium is common. 10% of nursing home residents will have it, and over 20% of people in hospital. It is highly distressing and frightening to patients and carers.
I was so grateful for the support of the team. After a while I was able to go home and was told an appointment had been made for me to be followed up in a clinic. I was given a leaflet which I read, and the doctor told me that now they knew I was at risk, things could be done to try and stop it happening again.
Right now, delirium is associated with a 35 to 40% risk of death in the year after it first presents, but it doesn't have to be this high.
It's important to follow up patients after an episode. Symptoms can resolve quickly, but in some cases can persist for months. In Bill's case, the right things were done at the right time and he made a full recovery. And when he came to my clinic with his wife a few months later, though he was still able to recall his distressing experience, I almost didn't recognize him.
With early detection, delirium is preventable and treatable. The important thing is if there is any sudden onset of confusion, please think delirium. We must suspect it, spot it, and stop it.